Given the rise in Candida infections and their increasing resistance against commonly used antifungal drugs, novel therapies for the prevention and the management of these infections are needed. Dietary modifications, like limiting the intake of refined carbohydrates, can be helpful for people with Candida infections. The higher dietary sugar is associated with vulvovaginal candidiasis, an abnormal glucose metabolism, and it's associated with recurring vulvovaginal infections. Diets rich in carbohydrates are also associated with Candida overgrowth in the gastrointestinal tract, and this can contribute to mucosal invasion. Lab studies indicate that excess glucose weakens the immune system's response to Candida, as well as the azole class of antifungal drugs. Candidiasis patients should maintain a healthy, well-balanced diet, as poor nutrition is commonly overlooked as a risk factor for the bacterial and fungal infections. Data suggests that probiotics like lactobacillus are beneficial against mucosal Candida infections, and they should be especially considered for women who suffer from more than 3 infections per year. Research shows the probiotics exert their beneficial action by suppressing the growth of Candida in various regions of the body, and by inhibiting Candida's ability to adhere to the cell surfaces. Dietary products containing probiotic bacteria, like certain yogurt, can help to control Candida growth in the body. In a study, yogurt containing lactobacillus was associated with a decreased amount of vaginal yeast detected by culture, as well as a reduced rate of vaginal discharge associated with yeast infections. While yogurt has long been considered a favourite natural remedy for vaginal candidiasis, and it's been shown to suppress Candida albicans growth, women must be careful to choose a yogurt that's low in sugar. Supplemental probiotics containing lactobacillus, administered either orally or vaginally, can also help to resolve urogenital infections, including yeast infections. In particular, the lactobacillus species Rhamnus and reuteri have been studied for repopulating vaginal flora and reducing yeast populations. Probiotics may also be useful after a course of antibiotics. Antibiotics are used to kill pathogenic bacteria, but they also destroy the beneficial bacterial flora of the vagina, putting women at risk for developing yeast infections. Probiotics also help to rebalance gut bacteria, and thus it can help to avoid symptoms of leaky gut syndrome. Resveratrol is a compound found in the skin of grapes, and it can contribute to the anti-inflammatory characteristics of red wine. In 2007, researchers investigated the fungicidal activity of resveratrol against Candida albicans. They concluded the resveratrol demonstrated potent antifungal properties, and it appears to be safer than conventional antifungal drugs. In 2010, further research revealed that the resveratrol impairs the ability of Candida albicans to convert into its more infectious form, and thus it might be a useful agent against Candida infections. In fact, resveratrol's chemical structure may form the foundation of an entirely new class of antifungal drugs. Golden seal is a herb that's been used to fight inflammation and infection. The active ingredient in the golden seal is berberine, and this has been shown to have strong antifungal effects against Candida in a lab setting. Berberine has also demonstrated a synergistic effect against Candida when it's used in combination with commonly prescribed antifungal drugs. Berberine might combat the Candida growth by interfering with the ability of the fungus to penetrate and adhere into the host cells. Study outcomes have been so positive that, similar to the case with resveratrol, synthetic analogues of berberine are being developed that might represent a new class of antifungal medication. Although berberine has been studied in human clinical trials and it's shown to have several metabolic benefits, concerns about long-term use of berberine have been raised. So on the basis of this, it's only recommended to use it in the short term. Lactoferrin is a protein that's found in mucosal secretions, like human colostrum, milk, tears, saliva, and seminal fluid. It possesses broad-spectrum antimicrobial activity against bacteria, fungi, viruses, and protozoa. Lactoferrin demonstrates a significant antifungal effect against a variety of pathogenic Candida species. In addition to lactoferrin's ability to interfere with Candida growth on its own, it also displays potent synergism with common antifungal drugs. It's been shown to enhance the antifungal effect of fluconazole against Candida. Although lactoferrin's antifungal activity against Candida albicans has been well established, the mechanism by which it achieves the effect is not clear. Lactoferrin's ability to bind to iron might contribute to its antifungal activity, especially since iron appears to enhance the proliferation of the Candida species. Lactoferrin derived from both bovine and human sources inhibits the growth of oral Candida. However, bovine-derived lactoferrin has been specifically identified as a promising treatment option for oropharyngeal candidiasis. Tea tree oil is well known for its medicinal value, and it's been used by the Australian Aborigines to treat colds, sore throats, skin infections, and insect bites. Tea tree oil has a variety of therapeutic properties. It's anti-inflammatory and it's antiseptic, and it's a popular ingredient in a number of natural cosmetic products. Tea tree oil is capable of eliminating a large number of microorganisms. It shows promise as a treatment for Candida infections. Animal studies indicate one of the active compounds in the tea tree oil, terpenin 4-ol, might be especially promising for treating the drug-resistant forms of vaginal candidiasis. Furthermore, the tea tree oil might have beneficial effects against fluconazole-resistant oropharyngeal candidiasis. Lab research indicates the tea tree oil might exert its yeast-killing effect by inhibiting Candida's ability to replicate. It also appears to interfere with the membrane properties and functions of Candida. In addition, research has demonstrated that tea tree oil reduces Candida's ability to adhere to human cell surfaces. Although tea tree oil is occasionally associated with contact dermatitis when it's used topically, it's generally considered to be safe. However, it can be toxic when it's ingested orally, producing a variety of negative effects like vomiting, diarrhea, and hallucinations. Therefore, it's typically used topically and should be kept out of reach of young children. Essential oils refer to compounds found within aromatic plants that give them a particular odor or scent. Most essential oils are a mixture of various chemicals, which are of clinical interest due to their large spectrum of biological activity. Although tea tree oil is considered one of the most important essential oils for biological activity against Candida, a wide variety of essential oils possess anti-Candida properties. Experimental models involving geranium oil, or its main component geranol, show it suppressed Candida cell growth. In addition, clove oil and its major constituent eugenol has shown particular potent effect against Candida, and it might be effective against multi-drug-resistant forms of Candida, alone or in combination with other antifungal drugs. A lab study demonstrated the essential oil from the Moroccan thyme might act synergistically with common antifungal drugs, potentially reducing the need for high doses, which can minimize their associated side effects. Research has also identified the essential oil of lemon verbena as a promising alternative for the treatment of candidiasis. For centuries, garlic has been used as a popular food, spice, and herbal remedy. Garlic has been noted to possess cardiovascular, anti-cancer, antioxidant, and antimicrobial benefits. Garlic and its constituent allicin can cause a potent growth inhibition in yeast, and it can be effective against mucosal and systemic invasive candidiasis. Research suggests that allicin, due to its effects on reducing the growth of a biofilm, it can reduce Candida's ability to become resistant to common antifungal drugs. The allicin might also decrease the production of Candida by disrupting its membrane. A clinical trial found the topical administration of a garlic paste was as effective at suppressing the symptoms of oral candidiasis as a prescription antifungal treatment. Likewise, a clinical study on Candida vaginitis concluded there was no effective difference in treating the response between a vaginal cream containing garlic and thyme and a vaginal cream containing prescription antibiotics. Active hexose correlated compound, or AHCC, is an extract derived from the fungi of the Bastomyces family. The AHCC has demonstrated biological activity against a variety of disorders. Experimental research has shown that it even appears to be protective against Candida infections, especially among the immunocompromised. Caprylic acid is a medium-chain fatty acid, and it's found in low concentrations in mammalian milk, and in relatively higher concentrations in some tropical oils like coconut oil. Several in vitro experiments have shown that caprylic acid and related compounds have anti-fungal effects against several fungal organisms, including Candida albicans. However, the extent of published peer-reviewed literature supporting the use of caprylic acid as a treatment for fungal infection in humans is limited. Nevertheless, integrative health practitioners often recommend caprylic acid in a wide range of doses for gastrointestinal candidiasis. Boric acid is the most common form of the mineral boron, and it's often used as a supplement for building strong bones and muscles, as well as supporting cognitive function and muscle coordination. Boric acid has also been shown to inhibit the growth and the reproduction of fungi, and it's used intravaginally to treat yeast infections. In a 2011 review, it concluded boric acid might be recommended as safe, effective, and relatively cheap treatment for recurrent yeast infections. The boric acid has also been proven to be efficient for the treatment of most yeast infections that are resistant to conventional therapies, and thus it might be considered a second-line alternative treatment option for this indication. For more on Candida, herbs, supplements, or natural treatment plans, check out my website.